We have to understand it on a very fundamental perspective. In other words, the analogy that I use, which is really, really simple, is that Gutenberg unlocked words. He built a printing press. Now, that took 200 years to catch on. It was mediated in part by the Bible, but still people couldn't read. So what good is a book if you can't read? But in the final analysis, Gutenberg unlocked words. Then the internet came along, and what did it do? It unlocked facts. Principally, Google and search engines unlocked facts in a cold, sterile, transactional way. Well, here we are now, where AI and large language models is unlocking thought. From facts to thoughts. And that thought is not transactional. That thought is iterative. And it's that engagement that is profound. So that's where we are conceptually. We're in the cognitive age. But there's a practicality to that. And what we see in terms of the adoption of AI in clinical practice is that it's not one curve. We often look at, well, what's the adoption rate? 60, 20, 30%? No, that's not the way to look at it. We're actually seeing two curves. One curve is in the logistical capacity, scheduling, even something like drug-drug interactions, where there's a fairly mechanistic underpinning to seeking those things.